Remeex is a sling that we use, and it's for all types of incontinence for men. And so we are, I'm very happy to be able to speak to you. It's one of my favorite slings to use because it's very versatile and it's very effective at treating all types of incontinence. I see a lot of patients for different type of issues. I like to think of my practice more like my full title is female urology. I think of myself as more avoiding dysfunction specialist. And so I take care of that, and this includes male incontinence. So I have no financial disclosures. So I'm going to start with the patient selection. And so the male patient selection is important when we're determining what surgical procedure we're going to offer the patient. We like to start with mild incontinence, which will be, in my opinion, less than 1 pad per day. Some doctors like to do this in pad weights, and we'll get to this in the next slide. But in all generalities, I like to make it simple for patients when we're evaluating them. And for the mild patients, here in America, we can use bulking, which is traditionally used for females, and there are different types of bulking agents that we can use. I'm very fortunate to have worked for the man who invented the bulking procedure, and we used it for something else, which was for reflux in prior decades ago. It was Dr. Victor Politano, who was my chairman. Now we use different agents, but microplastic, coaptite, and a newer substance, which is available in Europe and not quite yet here in the United States, called Bulkamid. The thing also we can use for mild patients are what's called ProAct, which is these inflatable balloons that go on either side of the urethra, and they coapt the lateral aspect of the urethra, and that can actually be adjusted as time goes on. The Advantage sling, which is more like a TOT sling for all the female urologists and urogynecologists in the room. This is a very familiar type of process that goes side to side. And then the Remeex sling, which we're here to talk about today, which is more like a TVT, or like I like to think of it, more like a pubovaginal sling. And that's why it's become very familiar to place this sling, because it's very familiar to everyone in this audience in terms of how they're going to think about this sling. The moderate leakers, we're going to say 3 to 5 pads per day. We can do what's called a virtue sling, which I like to think this is a lot like a TOT also. It goes on the bottom of the urethra, and it kind of gets its continence from side to side pressure. And then obviously the Remeex sling, and then doing a Adams, which is a newer sling, which is also an inflatable sling that gives compression from the bottom also. But it also like to think of this like a TOT also. And for severe patients, generally we're going to use an artificial sphincter. And how I classify severe patients is what I call gravitational leakage. And what that means is that they're just standing there and they're leaking out without volitional voiding. But some patients can have severe leakage and have volitional voiding. And I think in those patients, a Remeex sling can be an alternative in those patients also. And where Remeex is really ideal is in radiated patients, because for the prior slings that we discussed, they're very difficult to place and or get continence in a radiated patient, because it requires significant lifting of the urethra, and radiated tissues are very difficult to displace anteriorly. Again, I want to go over this. It's pad weight tests, mild to moderate. You see the breakdown into what we would offer a patient in these different situations. This Remeex device itself, it comes with a manipulator, which is I like to think of it like a screwdriver, which actually turns the versitensor, which is a spool that brings up the tensioning and can adjust the sling. There's a base plate that holds it against the fascia, and then the threads, and then that go down underneath the urethra, and then the polypropylene arms that kind of go up behind the pubic symphysis to the abdominal wall. It also has these things called peak bars, which I think is an important point, because the mesh is great for the posterior coaptating when it lifts up, but these peak bars also are firm, and then what they do is give you more lateral coaptation. So you get not only inferior but lateral support when you do this Remeex sling. And I want to just show this slide here. This cartoon will give us kind of what I was saying earlier. The artificial sphincter has circumferential compression of the urethra, as you can see. And then the adjustable sling with the Remeex, you can see, is very much like a pubovaginal sling or TVT, where it gets the abdominal uplift. And you can see by this arrows on either side, you get not only posterior compression, but lateral compression too. And when we go to the other slings, like the Adams or the Virtue, you can see that it goes side to side like a TOT does, and doesn't get a significant amount of compression of the urethra as opposed to, let's say, the Remeex. And how does the Remeex work? So much like a pubovaginal sling, as the bladder fills and you get abdominal compression, it lifts the urethra and gives us this compression, which increases the outlet pressures. And so these outlet resistance really is what adds to not just the passive compression or passive fixing of the leakage, but also active fixing of the leakage, which is kind of shown in here. And again, the filling phase, as the bladder fills, it gets stressed, abdominal wall lifts up and gives us that compression, and it gives our bladder outlet closure pressures increase. And this slide here kind of shows exactly what I'm saying. This cartoon shows the uplift of the urethra to the abdominal wall and showing the compression of the proximal urethra with the abdominal wall with any stressful situation. So my personal experience, I've done 20 patients in the last 2 years, and I have a high patient satisfaction because all the patients, all 20 of them, were continent. Now, my continence in my outcomes is with less than 1 pad a day. They can be, when I put less than 1 pad a day, it's generally just a few drops that most of these patients have, and they are highly happy with this. 5 patients required subsequent adjustments, which is important because some doctors want to know how often do you have to do this. So generally you adjust the patient about the first or second day after the surgery. You remove the tensing device, and then they'll come back within a month. And if they have any more leakage, then you would redo them. But my patients generally were dry at 1 month. And I've had the 5 patients that required the subsequent readjustment were generally around 1 to 3 months that I had to redo them. And then all of those patients are dry. I have not had to do a third adjustment on these patients as of yet. The patients where I think that this is a really good idea is patients who failed the slings, a sphincter. Almost everyone in here probably knows about these sphincters. And one of the downside to a sphincter is that they have atrophy that occurs generally between 3 and 5 years. And we have to come in and remove those patients' sphincters and replace another one. So what I did in those patients is essentially deactivated the sphincter and see if they were gravitational versus volitional voiding leakers. And all 10 of them were volitional voiders. So I offered them to take out the AMS, the sphincter, and place in them a Remeex, and those patients were continent and dry. And again, like I said, ideal for the radiation patients. So conclusion, it's a great tool for all types of patients, mild, moderate, and even some severe patients. It's easy to place. It's very familiar to everyone in this room in terms of the way that it's done, because all of us are very well versed in doing TVTs or pubovaginal slings. We have the ability to increase or release the tension if the patient needs, if it goes in retention, to release it, or increase it if they're having any leakage where the sphincter currently does not have that ability. And it's a low rate of complications compared to the sphincters. And I'll let Dr. Arando talk about this a little bit more in his talk that's to follow mine. And the higher success rate than the other non-adjustable slings that we just mentioned. Thank you very much. Gracias for allowing me to speak to you today. And I hope that you enjoyed the talk.